Welcome to day 4 of my 5-part series on hiatal hernia. Today we're talking about the big thing, today and tomorrow actually, which is how do you treat it? How can I truly get better with my hiatal hernia? And today I'm going to be talking about the internal treatment. Tomorrow we're going to be talking about the structural aspect of hiatal hernia. Both tend to be very commonly present. For sure today is the one most common, which is why do I have it, So the symptoms are acid reflux, heartburn, also known as GERD. You've got the bloating, gas, discomfort, can't maybe eat too much without your stomach bothering you, constipation, diarrhea, and then of course the heart palpitations, panic attacks, etc., etc. So what do we do for this? So you maybe heard me say we have very high success rate here at Root Cause, which we absolutely do. So the question I always get on my comments is, well, what do I take? And that's a very, American or, industrialized nation viewpoint of, it's like, I have this, what do I take? For like, it's a 1-for-1. Like, I have a headache, what's the best pain reliever? And it's not that's not what we do. Remember, what's called root cause for a reason, because we want to get to the reason why, not just manage the symptom. That's what traditional medicine does. I'm not saying that's always a bad idea. Sometimes it's handling a life-threatening situation, but when we're talking about hiatal hernia syndrome, we want to actually fix it, not just manage it. And unfortunately, conventional medicine, will start with that. The first thing they'll do is put you on a PPI, a proton pump inhibitor, some sort of an antacid, because you have the reflux, you have or heartburn, you're very uncomfortable. They might have done an endoscopy and say you have esophagitis, so inflammation of your esophagus. Maybe you have a hoarse throat, sore throat. Sometimes things get stuck in your throat, which is really scary when you're eating and all of a sudden something's stuck in your throat. That will give you, for sure, a panic attack. But it's due to that inflammation. So they do the PPIs. It reduces the acid, and your esophagus can feel better, and your stomach might feel a little bit better, but now you've offset digestion terribly because the stomach is supposed to be a bag of acid. Another thing to consider is a lot of times you have symptoms of acid reflux, and concomitantly, meaning at the same time, you don't have enough acid. And that's very counterintuitive, I understand. You go, that's nice, I feel a burning in my throat or in my chest. Yes, the stomach can have insufficient acid, and then bubbles of air can come up with a little bit of an acid coating, and those bubbles burst, and you have acid, it's true, but the root of it is insufficient acid in the stomach and not too much. Somebody who says, wow, I've really struggled to find a pattern, I understand, and it can be very frustrating that way. It's like, I eat the same thing for breakfast, and some days it bothers me, some days it doesn't. And so it's not necessarily right away that you feel the reaction, which is why you can struggle to see these patterns. But food sensitivities are almost always involved at some level with hiatal hernia syndrome. So diagnosing those is an integral part of what we do. Gluten sensitivity can be a big one. There is a great lab test we use for that. Unfortunately, there is not a perfect lab test. I'm going to sound sort of aggressive here, but I don't care if you've heard of other food sensitivity panels and, get some blood and we'll tell you 200 different foods. They're not accurate. They have a lot of false positives, and they're not yet accurate. Once the gut has settled down a little bit and it's less leaky or hyperpermeable, then those tests tend to have better results. But in the beginning, which is when we do them, when you really need to find out yay or nay, we stick to the gold standard, which is elimination and provocation. So for the gluten sensitivity, we have that test, which is very, very accurate. And for the rest of the foods, we do the elimination and provocation method. So after that, what else? We do a test called a stool analysis, because that evaluates the microbes in your gut for the presence of everything from bacteria, fungi, parasites, yeast, protozoa, an analysis of leaky gut or not, what the good bacteria are doing versus the bad bacteria, so kind of a balance or ratio of those. So it's a very comprehensive test, and you know, a lot of times people say, well, just assume I have bad guys. What should I take? And it's a legitimate question, it really is. But these are very specific. So you can't guess at what's in your poop, okay? This is a test that's cultured for 3 weeks. This is not at all the test that when you go to your gastroenterologist and they have you do a stool test, they're looking for a few parasites of an acute nature. So it's like you just got back from Mexico or some foreign land and you've got an acute infection. Usually you have watery diarrhea associated with that. It's acute, meaning it's happening right now. What the test I'm explaining, and to finish that thought, the conventional test is also looking for blood in the stool, so any indication of cancer. So that's what that test is about. Question, have you ever had a patient with iron deficiency anemia and a medium hiatal hernia, no bleeding? Yes, absolutely. We've seen, and the anemia can, and I'm sorry, the comment came and went so fast, but the anemia could be from a variety of reasons. It doesn't necessarily mean your hiatal hernia itself is causing bleeding. So we would analyze both those separately and see what the root cause is. So getting back to the stool test, the one at the hospital is for acute parasitic infections and any blood in the stool that you can't see, and then we have the test that I'm describing, which is it's cultured over the course of 3 weeks, so it takes 3 weeks to get back, and it's very, very comprehensive. So again, it's not something you can't guess at who's home, as I like to say, in your stool. You have to test, don't guess. So again, when people say, well, what should I take? There's not a simple answer for that at all if you really want to get the job done. Now I know there's plenty of channels on YouTube that will give you recommendations, and I sometimes give basic recommendations as well that I think are generally acceptable. But when it comes to hiatal hernia syndrome, it's called syndrome for a very good reason. There's a lot of different factors coming in to create it, and we have to take each of those factors and really resolve them for you. How did you get there? How did that poor stomach get so squished that it's getting pushed up on your diaphragm and pushing up on your heart and creating shortness of breath and creating heart palpitations and creating panic attacks? There's quite an imbalance in the gut that might have started in childhood, and let that not overwhelm you, because just because it started in childhood doesn't mean you can't fix it. But maybe you had a lot of antibiotics, maybe you just grew up on a terrible standard American diet, and the imbalance that has ensued from that has created more and more inflammation in your gut, and now here you are with this hiatal hernia. So hiatal hernias don't just, happen overnight. They're usually a slow trajectory over time as gut health is worsened and worsened. So we're teasing that apart to really get to the root of what we need to do to rebalance the gut. And I don't care if you've been on proton pump inhibitors for 2 decades. We have plenty of patients who have been on them that long, which is scary because they do a lot of damage. But the ability to get people successfully off their proton pump inhibitors with getting to the root cause, as I've said so far, I've only mentioned food sensitivities and looking at the stool analysis. The third component there is toxins, like a mold exposure or heavy metal exposure can also create inflammation of the gut. But when we tease it out and find out really what's at the root cause, then that stomach can relax, the inflammation goes down in the gut, and you don't need the proton pump inhibitor. The stomach is not in spasm, it's not squirting the acid up the esophagus, or as I mentioned earlier, maybe just little bubbles and you truly don't have enough acid. We're also evaluating for an infection that, if you have an endoscopy, they usually check for. It's called H. pylori, so it's a bacterial infection in the stomach. But if you haven't been checked, then the stool test will do that as well. So I hope this is making sense as far as really the comprehensive look of what you need to do. It's like, can you take some apple cider vinegar and feel less burning? Sure. Can you take some aloe and it soothes your esophagus? Great. Is it getting to the root cause of why you have all the inflammation in your gut and why your stomach is in spasm? It is not. Now, I'd much rather have aloe than have a PPI, because one is dangerous and one isn't. But it's still a Band-Aid, and I hate Band-Aids. And not that I don't use them at times to give somebody some relief, but you want it fixed. Not only do you want it fixed because it's miserable to feel this way, but the other reason, even more, maybe more importantly, is that when you have poor gut health, you can't possibly enjoy long-term health. You just can't, because the gut is what's turning food into fuel, feeding your 10 trillion cells in your body and keeping them all healthy. So it's critical to have strong gut health. The other thing I wanted to mention, and tomorrow I'm going into the structural side of how we treat hiatal hernia. But the other part of today is looking at the nervous system and hormonal health. Because what can happen, maybe you're somebody who's had issues with anxiety, depression for a long period of time. Or maybe with this increased inflammation of the gut, and now you're not being able to breathe as well because the diaphragm's in spasm, and you're having these panic attacks or attacks of anxiety that you never had before, and it's very foreign to you because you're not that person. You know, you're not a high anxiety person, and now you suddenly find that you are. So whether it's a long-term or short-term, the hormones and the nervous system that gets into this fight or flight kind of panicky mode because you're not getting enough oxygen, it can offset those hormones, and we need to rebalance them as well. So another facet of what we look at is looking at the nervous system, looking at the hormones, not just the sex hormones, but looking at the thyroid also, looking at the vagus nerve, so that's part of the nervous system, not hormonal based. So this is all part of what has to be evaluated. But we look at the body as a whole. That's what we do. So it's not just, oh, here's a quick fix for your acid reflux, or here's a quick fix to lower your gas, or here's a quick fix to get your colon moving so you're less constipated today, or that's just not what we do, and you probably are getting the idea I'm pretty radically opposed to that. But I am, because it's not a real fix, and I think it's disingenuous to label it as anything but. Now, we don't have a 100% success rate. It's closer to 85%, which is very high. And it's because we care, and because we handhold, and because we have a registered dietitian, too, as part of our team that works with diet and lifestyle in addition to this testing that I've described. So I hope all that makes sense. Please, reach back out, ask questions, because I'm doing this series every day this week to really give more clarity. Because again, what you hear is, oh, just take the antacid, you'll be fine. And you don't hear about all the side effects of taking an antacid. You hear about the surgery. Oh, just do the surgery, you'll be fine. And it has very poor results. So I don't want that for you or anybody you know. I want full resolution, and that is something we know how to do, and we'd be delighted to help. So if you enjoyed this content, please give it a thumbs up, like it, subscribe to the channel. I want more people to get help because a lot of people are suffering with this needlessly, and it's a natural program, no drugs, no surgery needed, and it works very well. So I'll see you tomorrow. We'll talk about the structural side of how to treat a hiatal hernia.